We now invite, let me invite you to give you.
Sorry.
I'd like to now invite Dr. Mohan Rajan to give his talk on the proactive management of chamber stability with advanced fluidics.
Thanks, Suvira. Thank you, AIOS, for the wonderful opportunity. This is about, I'm talking about the proactive management of fluidics. Is very, very important. Yesterday, when the live surgery, somebody was asking me which machine is the best. In my opinion, all the machines are best, but certain machines have definitely got an edge. The Stellaris Elite PC. Elite means the latest version of this thing, and PC is procedural choice. So if you see this cataract, you can see it's a grade 3 cataract I'm doing here. And I've done a rexis, I use my chopper. There are many ways to skin the cat as far as the hard cataracts are concerned. This is a sharp chopper, it's called Mohan Rajan chopper. Appa Swami makes it, I don't have any financial interest. The 1.75 chopper which I use normally. For black cataracts I use the 2mm chopper. And you can see here the whole thing. Okay, it not only occurs, it's called quick chop express, occurs very fast. I do the vertical chop. You can see the chamber stability is fantastic because it's a true venturi system. That's the beauty of this Stellaris machine. And every time I come out of the eye, I press the cotton bud, which I mentioned in the 2-minute video contest as well. And then I go ahead and put a Luxmart toric lens. And this is my choice as far as the EDOF lenses is concerned. And the Luxmart is a fantastic this thing. Just to show you, and
from Bosch and Lomb. It's capable of not only phacoemulsification, but it also has the vitrectomy system as well. The advantage of this Stellaris PC Elite is a true venturi system. Another advantage is you saw that the chamber was so stable despite the fact that I was using about 600 millimeters of vacuum. The dual linear capacity, the attune energy, the DICT, the dynamic infusion compensation technology, wherein automatically, because of the adaptive fluidics, you can see here, the chamber automatically gets stabilized. The intraocular pressure is continuously monitored.
so you don't have to,
And you don't have to bother about the chamber stability. You don't have to bother about the intraocular pressure.
Similar to that.
And this machine is actually a workhorse and across all types of cataracts, whether it's grade.
So I'm going to show you this adaptive fluidics, how it integrates the precision aspiration control with the DICT, which is called the dynamic infusion compensation technology. It creates a new standard for stabilizing intraocular pressure. The DICT, as I told you, is really fantastic. You can actually close your eyes and operate in a Stellaris PC Elite. Only thing is the patient should not close his eyes. That's very important. Again, because it's so stable, this chamber is so stable, you don't have to, in a peristaltic machine, normally when you are on about 40 ml per minute aspiration flow rate, when you are taking the last piece, you need to reduce it to about 20-25 ml because you don't want that flow rate to come and the PC to come forward so that the surge can occur. But in the venturi system, especially with in attune energy, and that is the biggest advantage of this. The adaptive fluidics is something which is unbelievable. It's incredible way of handling the intraocular pressure because the pressure, sometimes the gravity fluids, what happens is you keep it at 80, 100 centimeters. You do not know how much of intraocular pressure is going. A more amount of height, more amount of fluid going into the eye. If you see this cornea post-operatively, the corneal edema will be more, okay? Because it washes away a lot of endothelial cells as well. So it's not now, the new, the concept is to have a little lower bottle, like even Centurion, I have a bottle about 30 millimeters of mercury or intraocular pressure, that what's called the target IOP. So again you can see here, this another machine, I will not mention which machine is it, but it's a very top end machine, okay? It's a peristaltic machine. So I'm going ahead with the phaco, it's uneventful this thing, and you can see this is a fairly hard cataract, it's of grade 3, I'm chopping, I'm using my chopper, vertical chop, okay? Unlike RP, he does a combination of horizontal and vertical chop, I do vertical, many ways. You can see what is happening now. Last piece I'm taking, see what is happening. Can anybody tell me what has happened? Surge, it's because of surge. PCR has occurred. Immediately I brought it up and in front of this thing, injected viscode into the anterior chamber, and then rest is how I manage this patient. That's a different history. I want to show you how this surge can produce a problem in a PCR, especially when you are removing the last nucleus piece. And that's what I think the attune energy management is something which is anything. If you see it's like a piece of granite, this hard brown cataracts, which are very common scenario in our country, in our setup. And if you do a conventional phaco with this thing, without any cold phaco technology, which is there in the Stellaris PCA light, you can have a white cornea like this. And you can see many of these corneas can clear up, but the problem is 25% of the cases can have cystoid macular edema as well. So that is what is called the hyperpulse, which is there in the Stellaris PCA light. So this is the continuous mode. If you see of the continuous, we do the continuous mode, what happens is there is not only lot of phaco energy which is released into the anterior chamber and to the endothelium as well. There's also a lot of chatter. So what happens is the nucleus gets chattered, okay, and from the thing, and every time it moves around in the anterior chamber, there's a lot of turbulence in the anterior chamber, and that's why you get this white cornea, so the corneal edema. See this hyperpulse. The hyperpulse, what happens is you can reduce the pulse thing to as less as 4 milliseconds. And during the on time, it cuts the cataract. During the off time, it sucks the cataract and cools the tip as well. And that is the beauty of this cold phaco technology. You can see here, this is tell me when time is over, because if I give the mic to me, I'll keep on talking.
The bell will ring, sir.
Yeah, I'm just going to show you a couple of videos. You see this brown cataract, okay? Grade 4, grade 5. When I presented this, the ASR, Howard Fine was the same in the instruction course. Unfortunately, he passed away. He said this is grade 13 in the US. Okay, I told him grade 4, grade 5. In grade 13, we never see cataracts like this. Okay, and he practices in Washington State, in Oregon State, where only California cataracts are there. You can see here, I'm going bevel down in the Stellaris PC machine. You can go bevel down because this thing is so fast. The vacuum buildup is so fast. In Venturi, you don't have to go like the peristaltic. In peristaltic, you need occlusion of the tip for the vacuum buildup to go up. You see that we hear that mission sound, but you don't. In Venturi, it is not like that. There's no aspiration flow rate here. It's all vacuum based system. That is the beauty of the system. You can see here, because I'm using for the vitrectomy as well, you can see here how I'm cutting the cataract into smaller pieces, how my chopper works like magic. See, I'm using an 1.75 chopper, and you can see here how beautifully it works and how I'm cutting the cataract. The only thing is you need to make sure the posterior nuclear plate, but rest is so easy once you cut the cataract into smaller pieces. The dual linear is another beautiful advantage of this machine. You go to the yaw and go down. You can simultaneously increase the vacuum, you can increase the number of pulses, you can increase the phaco power as well. See, this is a black cataract of Niagara. You can see here, I'm making a deep trench there, and you can see the parameters which are there on the left top this thing on the screen. You can see here how I'm chopping that cataract. I'm making sure that I open up the posterior nuclear plate. It is very, very important for you to understand this whole ball game, and how this vacuum, because the holdability is directly proportional to the vacuum, and you can see how I'm holding that right piece and how I'm using the left hand. Make sure the chopper is directed directly towards the optic node. Don't drill the chopper. Keep the chopper right in front of the phaco tip there, and you can see how the chopper works wonderfully like this. I'm using a 2 millimeter chopper in this black cataract. 2 millimeter chopper is also multi-purpose. If you want to stab somebody in the abdomen, you can use that 2 millimeter chopper as well. So you can see the rock art cataracts. Pristine wound, pristine cornea, clear corneas, day one, especially when you're using premium lenses. All these, and again, pneumatic vitrectomy system, 20, 23 gauge, 25 gauge, 27 gauge, which we are using 15,000 by blade, and again, the advantage is of course, I'm stopping. Thank you very much. And for people who are here, postgraduates and practicing ophthalmologists, please email to me if you want this book. 2 books I'll send you, Cornea Atlas and Retina Atlas, drmohanrajan@gmail.com. And this offer, I want this offer from you. Thank you very much.
Hello. Anybody over here? Sir, few comments on peristaltic versus this Venturi system.
Yes.
Anybody knows the evolution of Venturi system? Anybody has the idea of how Venturi system was evolved? And there were 3 pumps when phaco machines manufactured.
Diaphragmatic pump was also there.
Diaphragmatic is the best pump out of all 3 pumps. The first is diaphragmatic, and the stores people came out with diaphragmatic pump. Has anybody seen or worked with diaphragmatic
Long
pump?
time back, we had one machine.
Yeah, it is very, very
96,
noisy.
97.
It's a very, very noisy machine. So the stores people manufactured two machines, one with diaphragmatic pump and another with Venturi pump, Protege. So, but diaphragmatic pump, they pushed Venturi pump very, vigorously. Diaphragmatic pump was making very noise, but all the machines were patented. So another big company was not able to manufacture anymore of Venturi pump. So they propagated peristaltic pump, and all PCRs what we are seeing, and anterior vitrectomy and so many things we are learning. Instead, I think personally, if we just switch over from peristaltic to Venturi pump, lots of things you need not to learn about anterior vitrectomy and so many. I really want to know from the audience how many people are using Venturi pump, phaco machine.
Nobody.
Not a single person. The moment you turn your peristaltic pump to Venturi pump operated phaco machine, you will forget to know how to do anterior vitrectomy. Believe me, this is my personal experience. I am in phaco, I'm doing phaco since 1996 onwards. I had 3 different machines, and the moment I purchased my Venturi system, I hardly know I might have disturbed PCE in maybe 5 or 10 cases in my 25-30 years of career.
Very fast. You need to have
Sir,
learning curve.
it is. No, that is the myth which we have been taught, sir.
No, it's a, see,
That is the myth we have been taught. I am very much against this myth, sir. The moment I shifted to peristaltic to Venturi machine, I regretted why I did for 7 years use my peristaltic pump. So the basic
We will go for
most basic pump operated Indian company from South India came with Venturi pump machine. I used that machine. Every machine, whether it is a 5 lakh cost machine or 50 lakh cost machine, will give you the same result. Believe me, this is my personal experience I'm sharing with you.
I have to only fully agree with Mukesh because it's fantastic to use the thing. The older concept was the peristaltic gives you time. It's a forgiving machine. I don't think so, because all the peristaltic machines are mimicking the Venturi. All the Venturi machines are mimicking the peristaltic. So they are more or less same. No, I have the Veritas
We will come
now,
to our
which has
next
got
speaker.
dual pump. Why,
Next
ma'am?
speaker.
Dr. Mohan,
Thank you very much.